Hello, my name is Holly Tanner with the Herman Wallace Pelvic Rehab Institute, and I'm here with Christine Stewart, faculty member who has written a course on menopause. So, Christine, can you tell us a little bit about yourself and your background?
Sure. I got interested in doing pelvic rehab when I was pregnant with my son, and he's now 20. So I've been doing this for quite some time. I work in a hospital now where I see mostly pelvic health, probably about 70%, and I still maintain about 30% orthopedic. So I do both of those things.
And what got you into teaching then?
Well, actually, Megan Pribyl, the woman that teaches the nutrition course, knew I was interested in teaching and approached me and she said, "I think you should try this." And so in 2017, I started TAing for Herman Wallace and then started to kind of get my feet wet with instructing, started teaching PF1 and then brought on 2A and 2B as well. So I was teaching the series and then COVID happened and life as we all knew it just completely exploded.
Yeah.
And that's when I thought, we don't have a menopause course at Herman and Wallace, and I think that we need one. So I decided to write a course. And I was
It-
certainly going through some symptoms myself and realized that the physicians that I was seeking information from often didn't have all the answers. And that involved me diving in to research myself and then realizing, oh, now I kind of realize what's happening with my body. And I just wanted to share that information with other healthcare providers so that they in turn could recognize those changes with their patients and educate them and then refer them on to physicians that have the knowledge that can help them with this transition.
And it sounds like in talking to you about menopause and how it applies to a lot of our patient conditions, it's so important to know a lot about all of the options because it is so individual in terms of what's going to be helpful, or perhaps someone's going to need to try several different approaches.
I think that is so true. Like what works for one person is not going to work for the other. But I want patients to be educated on what their options are. And I think as a healthcare provider, if you can have a good base knowledge of that, then you can educate them and then they can make that decision for themselves. I also think if you go out and you're on the internet, there's a lot of camps, camp hormone, camp not hormone. And the reality is, you can't just take a pill and have this magically be better, that it's truly a lifestyle approach when it comes to this transition and educating patients on it's it's your habits, it's your exercising, it's your nutrition that all are really important with helping this to be a successful transition to this next phase of life.
And so, what can folks expect to learn at the course? What kind of topics do you cover?
I think I cover everything. It is a lot of information. It is a lot. So we go through what perimenopause is, what menopause is, and we also spend quite a bit of time on what a normal ovulatory cycle is, because you have to understand normal before you understand what's happening as your cycles are starting to change. So we go through that. We go into a little dive on the research out there with regarding hormone replacement. We also look at heart health, brain health, bone health, changes in our genitourinary system. So we cover all of it, and I fully recognize it's a lot of information, but I think it's valuable not just for patients going through that transition, but patients that may be in their 30s that haven't hit it yet. Can we educate them on, hey, if you start to make some of these lifestyle changes now and set yourself up for success, it can make that transition easier.
And so, the course is really great for the general practitioner in terms of covering all of those different systems of the body and the ways that folks get affected. How does the course also shine a light on some of the specific pelvic health conditions that our patients are really finding can shift during that menopausal transition?
I do an entire lecture on the genitourinary syndrome of menopause, which is really all encompassing for increases in urinary frequency, pain with intercourse, vaginal dryness, incontinence. Those are all things that can start to change as you're starting to lose estrogen and testosterone as well in that area. And certainly that can affect the entire lower urinary tract. So we spend an entire lecture talking about all those fun things that you get to expect as you're going through that transition. And certainly that happens often a lot sooner than patients realize. It's not that you have 12 months with no period and ta-da, you have all these symptoms. The
Mm,
symptoms can actually start to occur 10 years prior to that. So
mm.
recognizing that these changes can come in women in their 30s and not necessarily just women, in their later 40s and 50s is an important thing to note.
And what kind of questions are the practitioners bringing to your class? What are you feeling based on the questions and conversations that you're having within your course? Are the things that participants are encountering in the clinic and really coming up against that lack of knowledge?
I would say, as far as things that they're encountering, there's still a lot of questions about the different hormones
Mm,
that are options and understanding what those options are. So, oftentimes, when practitioners are taking the course, this is new information that they didn't realize because there is a lot of misinformation out there. And honestly, a lot of it too is they're realizing the power of exercise with combating a lot of these symptoms as well, and realizing how important it is to talk to their patients about these lifestyle choices that they can make.
So rehab clinicians are really well poised then in terms of
Oh
talking.
my gosh, yes. And that's what I realized when I was researching this course. It's like we're with our pelvic pain patients, we're already talking to them about so much of this, but realizing that it isn't just our pelvic pain patients we want to address this with. This is with most of our patients that we're seeing. We want to talk to them about, are they getting adequate sleep? How are they managing stress? How are they eating? These are all just basic things that we do as rehab therapists, but we just want to take it to that next level of addressing it with more of our population, not just necessarily just the pelvic pain patients.
And how do you bridge providing education to patients that still means they need to go talk to a provider who might be a prescriber, right? Because here we are, we're talking about some hormones, we're talking about perhaps some potential medication aids, but what does that look like in the clinic for you when you're educating folks and yet you need that bridge?
Oh, absolutely. Well, certainly we can't prescribe medication. So obviously, I just like to educate them about there are options.
Mm.
So if they've tried something and it didn't work, I will say, there are many, many options out there. And I would love it if you would go see a NAMS provider. So someone that I know is either a NAMS, so the North American Menopausal Society member, or if they've actually got a certification, because then I know that that provider is current on the information and they're going to have the best knowledge base possible, because that's what I experienced. I have a lovely family doctor. I love her, but when I went to seek her out, I knew a little bit more about options and realized, I'm going to go see a certified NAMS OB-GYN. And I did, and it was well worth it. She was amazing and spent lots of time with me and really educated me in a great way. And I realized that that's kind of how I try to steer my patients so that they can have that same experience.
That reminds me of a clinical experience I often would have with patients in asking them, hey, are you working with anyone right now to work on managing your hormones? And they might say, well, my primary care or this doctor, I talk to them about it. I say, like, are they passionate about it? Do they
Oh, that's so
really
true.
engage,
That's
do
so
they
true.
really engage with you about it? Or is it one of those things where they say, well, we can test your levels? And so I think even as clinicians, for us, that passion, that curiosity, that interest in really allowing people to think about all the different domains that can be affected in their rehab is just so important, and that it sounds like that's exactly what you're talking about.
Well, I will tell you, I've had a couple of experiences where I just had a woman that came to see me in her early 40s that fell. She was running, she was running out of the garage and tripped and broke her arm. And she's like, I've been in this, I've transitioned. Like, I don't have a period anymore. And she's only 40, she's 42. And I said, do you have a physician that's checking your bone density? And, going through this at such a young age, you may need to discuss different treatment options because you are so young going through this transition. So being able to give her a name and steer her in that direction, realizing it isn't just, again, it's not just our pelvic patients, but it's also our orthopedic patients that you need to start to recognize, that's a fracture at a young age with, most of the time when we fall and land on our arm, we shouldn't fracture. So why is it she was more susceptible? So starting to recognize that, starting to ask more questions about cycles. How regular are you? Is your cycle changing? Because that cycle, that ovulatory cycle, is a report card of your health. So knowing that's such an important screening tool to recognize when those changes are starting to begin can also be something that you want to consider when you're talking to your patients.
Well, I think that highlights the importance of us taking responsibility for any of that level of knowledge that we already do have and educating even our peers, right?
Oh,
Just for
yes,
the exact scenario
absolutely.
you described. Mhm.
I wish that all therapists, not just pelvic therapists, had a good knowledge of what this transition means and how broad it is, how it really affects patients of many, many different ages, so that they can also start to recognize, maybe they need to be referred to somebody that's an osteoporosis expert. Maybe they need to be referred to somebody that can address some of the symptoms they're experiencing because they're not sleeping. And if
Mhm.
you're not sleeping well, how are you supposed to heal? So
Mhm.
these are that was the neat thing about doing the research for this course, is realizing it's like I can help a lot of my patients get better by recognizing what's going on with their system as they're starting to change, as that ovulatory cycle is starting to change.
Well, and again, there's that passion where you've decided not only can you gather all of this research in your clinical experience, but you can teach other folks how to do that and how to recognize these concerns, how to provide resources for the patients so they can get some of the help that they need.
Oh, absolutely.
Yeah. Well, thank you so much for creating this course and for taking time to talk to us about it.
I appreciate it, Holly. Thank you.